Hi guys, it's Sam here. Welcome back to our channel. So today I'm filming my 4-week pregnancy update. So this week has been quite a tough week for us. So as I mentioned in my last video that we are in Spain, so we're traveling and we don't know how to get a doctor, so we're planning to go to the hospital for a first sort of checkup on how this pregnancy is going. So a few days ago we did do that. Went to the hospital. They checked my HCG levels and my level was around 710, and that's pretty normal for how far along that I thought I was, which was around 4 weeks and a few days. And the next thing that they wanted to do at the ER was to do an ultrasound. And I was kind of surprised because everywhere that I've read previously, you can't see anything on ultrasound until your HCG levels are at least 1500 to 2000. And mine clearly was not quite there yet. But the ultrasound tech just kept saying, oh no, I can probably see it, I can see it. So I was like, oh, okay. So of course she did the test and she didn't see anything, and she kept shaking her head and saying she doesn't like it. And she also saw a lot of free fluid in my abdomen, about 3 centimeters. I have a picture of it to show you guys. So that black stuff there and there. So yeah, she was very worried about that. She said it's a lot of free fluid, it's more than normal. And she was saying that it's likely to be blood and like there's internal bleeding, and she threw around the word ectopic pregnancy in my abdomen. So of course immediately I lost it. So it was pretty traumatic to hear that, and she did mention that my tubes were all okay, my ovaries looked good, so it was definitely not an ectopic in my tubes or my ovaries, but she suspected that it's possible that it could be in my abdomen. And so I was just like asking, if that's free fluid as blood, how come I haven't been bleeding at all? So she said, oh, because it's in your abdomen, so it's not in your uterus, so you wouldn't necessarily bleed. So I don't know, I was really confused about the whole thing. And she then said that she's going to do another blood test just to check my hemoglobin levels. And so they did that, and it was really like nerve-wracking because they did the test. They took my blood from my hand, like right here, and then as soon as they were done, they started setting it up for an IV. So I was just like, what is going on? And because everyone speaks Spanish, so many things were lost in translation. It was so hard to communicate. And essentially the nurse said that, oh, we're setting it up for an IV in case you might have to stay here overnight and be monitored if your hemoglobin levels are too low and it shows that you're losing a lot of blood. So I mean, I freaked out. Like there was no way I was gonna stay overnight in the hospital. And yeah, it was pretty tough. About half an hour later, the nurse came back and my hemoglobin levels were fine. So she says she's not really concerned right now, and to come back in a couple days, in 2 days, to do another blood test and do the ultrasound all over again, see where things are at. But of course, if I had any bleeding or abdominal pain, or if I was faint or dizzy or lightheaded, that I needed to come back to the hospital immediately, because essentially I could be bleeding out internally and dying. So it was pretty scary stuff. Those were definitely the longest 2 days of my life, waiting to go back to the hospital to do the follow-up test. And it was just like crazy. Like that whole time I was completely stressed. I was sobbing. I felt like this is a failed pregnancy. And I just felt like my abdomen was hurting, that I had all this internal bleeding. And of course now it's all like symptoms that I had made up in my head. But it was pretty scary stuff. So 2 days later, we went back to the hospital, and they said, well, it's not technically an emergency anymore, so you have to make an appointment with the OBGYN. And they have one in the hospital, not in the emergency section, of course. So we went over there, and we were lucky enough that the doctor was able to see us pretty quickly. So met the doctor. He just put me on for the ultrasound right away. And we saw a little circle, the gestational sac. Show you guys the picture. The little dot right there. So that's the gestational sac, and the doctor said, oh, I see the baby, I see the sac. And I was like, is it in uterus? Is it in the uterus? And he's like, yeah, it's in the uterus. Everything looks perfectly fine. Everything's normal. And I just like started bawling, and Danny was like so emotional, and he never gets emotional. And it was just like such a sense of relief and gratitude, and I felt really guilty about how I was feeling the last 2 days. So yeah, it was a good moment. And I had mentioned about what was that free fluid, like the ultrasound technician was really worried about it, and he said no, it's completely normal. If we see a pregnancy in the uterus, that's not even a concern. And he said the free fluid is actually from when the follicle in your ovaries release the egg, it ruptures, the follicle ruptures, and that's what that free fluid was. And even on the second ultrasound, there's a lot less fluid, so it just gets absorbed by the body. And I was just, oh my gosh. So yeah, that was a tough week. But we're just so happy, so grateful, so blessed that everything's going smoothly. So if you guys are worried, don't go too early, because it's not going to show on an ultrasound and you're just going to be stressed out about it. I would suggest at least waiting until the 5-week mark before getting an early ultrasound. And I know in Canada they never would take you in for an ultrasound at 4.5 weeks, and so that's why I was surprised that they were doing it here. But anyways, everything worked out. In terms of my symptoms this week, I would say it's been pretty similar to what I was experiencing last week in week 3. So my breasts are sore, I'm really thirsty, I'm hungry, and I'm also super tired. So, you know, typical pregnancy symptoms. But yeah, so that's kind of been my crazy week. Kind of wanted to share that with you guys, and if any of you is going through something similar, just be patient. It's possible that everything's gonna work out in the end, and just pray and hope for the best. And yeah, so let me know if you've had a similar experience, if you had free fluid early in pregnancy and it ended up being perfectly fine. But yeah, so that was our week. And at our appointment, the second appointment we went to was yesterday. So the doctor sent us for some blood work, just to do the full blood work for the pregnancy and a urine test. So we should be getting results of those in a couple days. So I'll be telling you guys all about that in my next update. So that was my week in a nutshell. Thank you so much for watching. If you guys are new to my channel and you want to continue on this journey with me, please hit that subscribe button below, hit that bell button to be notified anytime I post a new video, and just come along on this crazy journey with us. And yeah, if you're in your 4th week of pregnancy, let me know what symptoms you're having. I always like to see if I'm kind of having the same symptoms or the same experience as other women out there, so let me know. All right, thanks guys. See you next week in my next update. Bye.